Hello, and welcome to the PAHO podcast, Turning the Tide, NCDs, Mental Health, and the Urgency of the United Nations High-Level Meeting. This is a space where we have a conversation with experts on NCDs and mental health and unpack these most pressing health challenges. And I'm your host, Silvana Luciani from PAHO's NCD program. I'm really excited to bring to you today all that we're doing at PAHO with governments, civil society, academia, and the public to prevent NCDs and promote mental health and improve the health system response for better care for NCDs and mental health. Today, we're discussing the fourth high-level meeting of the United Nations General Assembly that's going to focus on NCD prevention, control, and mental health promotion. And in this episode, we want to focus specifically on mental health. And joining us today in the conversation is Dr. Renato Oliviera, Mental Health and Substance Use Unit Chief at PAHO. So welcome, Renato, and thank you for being here with us.
Thank you so much for having me, Silvana. It's an honor to be part of this conversation.
Thanks, Renato. And let's start with the basics about mental health, because we know that there's no health without mental health, yet millions of people are living with a mental health condition, and very few of them actually are receiving the treatment they need for their well-being. So what can you tell our listeners about the mental health situation in the Americas region, and what can be done about it?
The Americas faces a mounting mental health crisis, with 160 million people living with mental health conditions, fueling rising disability and premature death. Depressive and anxiety disorders were the second and third leading causes of years lived with disability in 2021. And between 2000 and 2021, years lived with disability due to mental disorders increased by 8.4% in this region. The region also includes countries with some of the highest suicide mortality rates worldwide. Suicide in the Americas has risen over the past 20 years, with over 100,000 deaths recorded in 2021. Despite this growing need, only 20%, 1 in 5 people of affected persons in the Americas receive treatment, far below the global average of 1 in 3. The region also has the highest proportion of long-term stays in mental institutions, an inefficient, outdated form of care that violates human rights standards. Stigma, discrimination, and neglect further exacerbate those vulnerabilities, Silvana.
Thank you. Thanks, Renato. So I'm hearing you say that anxiety, depression, those are the major mental health conditions affecting over 160 million people in the Americas region, but only 20% of those with mental health conditions actually get the treatment. So let's talk then about how this UN high-level meeting on NCDs and mental health is coming September can really help push the mental health agenda and help reduce some of those gaps in access to care. Renato?
That's what we hope. There is growing recognition of the impact that mental health conditions have on quality of life, economic productivity, and social development. The COVID-19 pandemic exposed how unprepared our mental health systems were, and that served as a wake-up call globally. As I mentioned, mental health conditions are among the leading causes of disability worldwide, costing trillions annually in lost productivity, long-term care, and healthcare expenses. These conditions are also closely linked to other health issues, reinforcing why mental health must be a priority. At the high-level meeting, we can expect strong focus on promoting mental well-being, along with a shift towards prevention and early intervention. There is growing awareness about the importance of decreasing stigma, one of the main barriers for people accessing care, and promoting a broader public conversation that moves us towards building systems that are available to identify and treat mental disorders and encourage people to seek care, to talk openly, and access support early. That's very much aligned with the ongoing work that we have been doing as PAHO in the region of the Americas.
Yeah, that's great. So it's the first time mental health is going to be part of this global multi-sectoral discussion at the UN. So we really are expecting a strong resolution calling for bold and accelerated action on mental health. And, PAHO has been leading efforts to increase access to mental health services throughout the Americas especially with the Mental Health Gap Action Program, which has successfully trained providers to improve mental health service capacity. So how do you think this political commitment from the UN high-level meeting will help advance PAHO's work in mental health?
Of course, one of PAHO's priorities is supporting countries to shift away from models centered on long-stay psychiatric hospitals towards community-based, rights-oriented, and integrated care. We do that by supporting countries in updating their mental health legislation to protect and promote the rights of people with mental health conditions and to align national health systems with community-based models of care. We know, Silvana, that the best place to receive mental health care is often at the primary health care level. That's why we work closely with countries to build capacity through the MHGAP program, where we develop the capacity of primary healthcare providers to identify and treat mental disorders as close as possible to the community. Through
Excellent.
PAHO's Virtual Campus for Public Health, we offer several online courses, and we are about to launch a new course focused specifically on child adolescent mental health in primary care. This reflects the growing recognition of the importance of supporting young people's mental health early in life. We also assist countries in developing or updating national suicide prevention plans. Suicide has been increasing in the region of the Americas. So we help countries to develop those national plans that can incorporate the most effective interventions as early identification and support, means restriction, fostering life skills of young people, and responsible reporting.
Wonderful. So we're really expecting that UN high-level meeting to help push that community-based approach, primary healthcare-based approach to increase access to mental health services, help reduce the stigma, help prevent suicide, and reach more young people that are highly affected by mental health conditions. Renato, as we wrap up our conversation, what's your final message to policymakers, health professionals, and our everyday listeners about mental health in the upcoming UN high-level meeting?
We are facing an unprecedented opportunity and responsibility to transform how mental health is addressed in our region and beyond. This is the time to move from awareness to action. We have the tools, we have the evidence to act. To make meaningful progress, we must integrate mental health into primary health care, where people already go for support. Primary care is the best entry point for delivering mental health care in a way that is accessible, inclusive, and non-stigmatizing. We also need stronger national legislation and sustained investment to protect the rights of people with mental health conditions and to ensure the availability of quality services for all. We also need to tackle stigma. Stigma still prevents many people from seeking help. By normalizing those conversations, like we are doing here now, and making support available in everyday settings, we can ensure that support feels safe, accessible, and respectful for everyone.
Excellent. Thank you, Renato. Thank you so much for sharing your insights on mental health in the Americas. Thank you to our listeners for joining us today. And I really hope we've brought you new information and inspired you to work on mental health, help reduce the barriers and gaps in access to mental health services, especially for young people, especially in primary healthcare settings. And if today's episode resonated with you, please share it in your networks. And also please visit the PAHO Mental Health webpage, where you can find resources, data, policy briefs, and a lot of information on mental health. Together, we can turn the tide on NCDs and mental health and protect the well-being of future generations. Until next time, stay informed, stay engaged, and stay healthy.